For concussions, red flag symptoms include slurred speech, decreased coordination, nausea, seizures, and knocked out or loss of consciousness. Other signs and symptoms that can be recognized are headaches, pressure on the head, fogginess, ringing in the ear, or sensitivity to light and sound. 1 to 3 days post-injury, the athlete might show signs and symptoms of headaches, pressure on the head, fogginess, double vision, difficulty concentrating or remembering, feeling sluggish, not feeling right, or trouble balancing. An athlete 1 to 6 weeks post-injury might be enduring headaches, pressure on the head, sensitivity to light and or sound, fogginess, difficulty concentrating or remembering, feeling sluggish, not feeling right, and trouble balancing. For a concussion, the majority of the damage happens in the frontal lobes, temporal lobes, and the hippocampus. The most commonly damaged nerve is the cranial nerve. A concussion is a traumatic brain injury caused by a bump, blow, or jolt of the head. A concussion can also be caused by a rapid back and forth motion of the head because there is a blow to the body.
So stiff when he's unconscious.
For concussions, immediate on-field treatment is to first ensure that the athletic scene that you may be entering is a safe place for you to enter. Once ensured, you may move to go help the injured athlete, but be sure not to move their neck or back uncontrollably, but rather in a safe manner. Seek professional help as soon as possible, as they will know what to do better and how to move the injured athlete. 1 to 7 days post-injury, the athlete should seek professional help in which they may be provided a return to sport and or a return to school strategy to help return to their day-to-day life. It is important to follow this strategy for the next weeks and stay asymptomatic in all activities they do.
Just push it.
A neurologist is a type of doctor who specializes in the diagnosis and treatment of nervous system disorders involving the brain and spinal cord, along with other nerve and muscular conditions. The educational path for a neurologist consists of a 4-year PhD course and a neuroscience, which at the end you will partake in an MCAT exam. After the exam, you can then begin your medical schooling. Once your schooling is complete, you must partake in a minimum of 1 year internship program, followed by a 3 to 4 residency training program. The purpose of the internship is to gain and strengthen required clinical experience and required skill sets. Over the course of your residency, you will be supervised and accompanied by a trained and active neurologist. If ready, you will then be presented with a professional career. During your neurologist career, by working in Canada, you will be making an average of $315,000 and $183 yearly, or $152 an hour. If choosing to work outside of Canada, your income will be set at an average of $276,800 in countries similar to the United States. The location where you will practice your study can be seen in one of 3 settings: private offices, clinics, or academic settings like school sports teams. For the case of the film, we focus on the academic setting of school sports. If an athlete has suffered a form of neurological injury, the first thing that must be conducted is check of pupil dilation, loss of feeling around the neck and face, muscle tightness, and soreness. What is important to understand is that the neck should never be moved past the given limits. It must stay within its resting position. If absolutely necessary, then the neck is able to be moved, but only at a minimal rotation. Once arriving at the hospital, then the role of the neurologist is to conduct many tests such as a CT and MRI scan, nerve conduction studies, and a CT myelogram. After you, as the neurologist, have come to the conclusion it is what has happened, it is up to you to make the call for whether to keep the athlete in attentive medical care or refer them back to their sports teams for both themselves, coaches, and sports psychologists to determine what is framed for before the athlete can return to play. If symptoms don't disappear or begin to worsen, return back to the hospital and seek help from a neurologist.
A neurologist does physical tests to make sure your brain is working as it should, testing your strength, reflexes, coordination, balance, hearing, nerve function, and ability to feel, along with your mental status. Anyone who gets a concussion should go to a neurologist as soon as possible. If the symptoms are reoccurring or don't go away or continue to get worse, you continue seeing your neurologist. After seeing your neurologist will perform a neurological exam regularly until you can be cleared from your concussion. They usually check mental status, speech, balance, reflexes, and vision, indications of a mild TBI or a severe brain injury.
Good afternoon, Mr. Henry.
Hello.
I'll be your doctor today. My name is Mr. Scholey,
Perfect.
and I'm going to be running through some tests with you today.
Yes, sir.
This is my expertise right here.
Okay.
And these are the tests we're going to be doing.
You may be wondering, how does one get into this position and become a sports psychologist? The answer is plain and simple. With hard work in school and dedication, you would need to graduate high school with the required qualifications to then be able to merge into the required classes in post-secondary, such as kinesiology, psychology, sports medicine, along with business and marketing. But overall, a master's or doctoral degree in clinical counseling or sports psychology is an absolute must when looking to pursue your sports psychologist career. A PhD in sports psychology field requires 3 to 5 years to obtain. Sports psychologists often spend a majority of their time in an office or hospital environment where they are able to treat an athlete in a familiar setting. However, there are some cases where sports psychologists can spend their time in the same environment as the athlete is in, such as the soccer field or locker room. The daily responsibilities a sports psychologist has when treating athletes are communicating with athletes' coaches and families, helping athletes psychologically prepare for competition, educating athletes about various relaxation techniques they can use, meeting with athletes for consultations and evaluations, mentoring coaches about ways they can improve their players' mental states, researching how sports affect an athlete's mental state, and writing detailed reports on the injury and progression. Sports psychologists spend majority of their time with patients that are involved in sports and at a younger age still going through the developmental phase of their life. Most sports psychology careers work with athletes on motivation, stress management, visualization, effective teamwork, and other psychological factors affecting their athletic performance. The salary for an average sports psychologist in Alberta is $82,396 per year, In Canada, the average salary is $107,679 per year. Moving across the border to the United States, the average salary is $79,617 US dollars, which translates to 106,698 Canadian dollars. Moving across the North Atlantic Ocean to Europe, the average salary is £20,000 for a starter and £48,000 for an experienced worker, which translates to $33,317 for a starter and 79,992 Canadian dollars for an experienced worker. Our regular office sports psychologists typically work 5 days, Monday to Friday from 9 to 5. However, if you specialize in athletic sports psychology, then you may work irregular hours, ranging from daytime, evenings, weekends, and holidays, working around the athlete's schedule to accommodate for their success. The pros to becoming a sports psychologist are having many options for hiring organizations. There are various specialties you can choose. You can be autonomous. You can travel. Every day is different. It is a rewarding career as you are helping others. And finally, people are likely to respect your profession. The cons to becoming a sports psychologist are few learning institutions offer a sports psychology degree. You may need a graduate degree. Your degree program may require you to write and defend a dissertation. Schooling can become expensive. You may work irregular hours. You may travel more than you prefer. And finally, it can be emotionally taxing.
When an athlete suffers a serious concussion, a sports psychologist plays a vital role in the recovery and rehabilitation process. Here are some of the key responsibilities and roles a sports psychologist may have in such a situation. Emotional support. A sports psychologist provides emotional support to the athlete and helps them cope with the psychological impact of the concussion. This may include dealing with fear, anxiety, frustration, and depression that can arise from the injury and its consequences. Education and information. The sports psychologist educates the athlete, their family, and the coaching staff about concussions. They explain the symptoms, the recovery process, and the importance of following medical advice and protocols. Psychological assessment. The psychologist conducts a comprehensive psychological assessment to evaluate the athlete's cognitive and emotional functioning after the concussion. The assessment helps identify any cognitive deficits, mood disturbances, or psychological issues that may need to be addressed during the recovery period. Treatment planning. Based on the assessment, the sports psychologist collaborates with the athlete's medical team to develop an individualized treatment plan. This plan may include cognitive rehabilitation exercises, relaxation techniques, stress management strategies, and counseling to address any psychological challenges. Cognitive rehabilitation. The psychologist may work with the athlete to develop strategies and exercises to improve cognitive functioning, such as memory, attention, and problem-solving skills. This process can aid the athlete in regaining their mental sharpness and optimizing their performance. Coping skills and resilience training. The sports psychologist helps the athlete develop coping skills to deal with the challenges of the recovery process. They may provide techniques for managing stress, building resilience, and maintaining a positive mindset throughout the rehabilitation journey. Return to play readiness. The sports psychologist collaborates with the medical team to assess the athlete's readiness to return to sports safely. This assessment involves evaluating the athlete's physical and psychological recovery, ensuring they are mentally prepared to resume training and competition. Communication and support network. The psychologist facilitates communication between the athlete, their family, coaches, and medical professionals. They ensure that everyone involved is informed about the athlete's progress, setbacks, and any necessary modifications to training or competition plans. Overall, a sports psychologist's role when an athlete suffers a serious concussion is to provide psychological support, facilitate the recovery process, and help the athlete regain their physical and mental well-being to return to sports successfully. In terms of the duration that a sports psychologist may remain with someone suffering from a concussion, it is apparent that they stay with the injured personnel until symptoms of the concussion are no longer present, as they contribute to each and every part of the recovery. Accordingly, it is advised that a patient suffering from a concussion should reach out to a sports psychologist as soon as possible.
Go, bro.
Let's go.
Need you to repeat like as many as you remember. Okay. So crayon.
Yeah, I can't tell. Watermelon. Black. Scarlet.